So continuing again with the innate immune response, talking more about chemicals. So these are going to be also ways that we can fight against pathogens, but they're not cells. They're either proteins or chemical messengers. So we're going to talk about more of complement in a little bit, but it helps the release of histamines. Again, remember that is going to be our major inflammatory chemical. So that is going to be vasodilation and leaky capillaries. Chemotaxis, I'll explain a little more again on another slide, but chemotaxis is calling for chemicals, so complements a protein. It's a group of proteins. So what it happens is if complements in the area, it's going to send out a message. Think of it as kind of a text message or a group message to the neutrophils to meet them at a specific area. So it tells them to come to the area because they're needed. Phagocytosis is going to be because you're calling the neutrophils to the area, then they are going to be your most abundant or most numerous phagocytic cell. You'll also bring macrophages to the area as well. And complement the group of proteins themselves can actually kill bacteria as well. Leukotrienes are going to be part of the inflammatory process again. They are going to increase capillary permeability, which leads to the edema or swelling, as well as the pain because of the pressure on the nerve endings. They are also chemotactic, meaning they're attracting phagocytes. A lot of times it's going to be neutrophils to the area. So again, chemotaxis or chemotactic that we saw on the last slide is phagocyte mobilization, meaning those inflammatory chemicals, leukotrienes, histamine, complement, all of those things are going to increase the movement and attract them to the area. So basically, like I said, it's a group message saying all meet in this one spot because you're needed to help. So it's just a call for help. So you can kind of see these chemokines. You can say all your chemical messengers, bring all the neutrophils to the area. Within about an hour of onset of inflammation, so tissue, remember this is when tissue damage occurs for many reasons, but we're talking about infection. So phagocytes appear within about an hour. These first ones are going to be the neutrophils. So the ones that are going to be within an hour are the neutrophils, and macrophages then follow. Again, neutrophils are going to kind of get there quickly. They're first responders, but they're going to die first. Then macrophages not only kill the pathogens, but they're the janitors. So they're going to disinfect, you can think of getting rid of the pathogens, but they're also going to clean up the mess the neutrophils left. So any dead or worn out neutrophils are going to be eaten by macrophages, and macrophages are also going to help clean up the damaged tissue cells or fibers or anything. So again, call them the packmen because they eat all the time. You can also think of them as the janitors. They clean and then they pick up the mess. So phagocytes, again, are going to be attracted just by microbes. Those microorganisms are going to attract these neutrophils and macrophages to the area. Complements, chemicals called kinins. Also other neutrophils. So if you have, say, a couple neutrophils are called to the area, well, then they'll send out messages to other neutrophils, so then they'll come. So it's all about chemical messengers, because you think about it, if you have an infection on the tip of your finger, You had a cut, it got infected, and you have inflammation there. Well, neutrophils are circulating throughout your body. So you need to make sure that they understand that they need to go to the tip of your finger. So there's going to be a lot of messengers calling out to them so that they can go and flood the area. So we learned about leukocytosis. So leukocytosis, again, is an increase in overall white blood cells. Sometimes the leukocytosis can be because of all the white blood cells, but say if you have an increase in neutrophils or monocytes, or eosinophils, anything like that, that will increase your white blood count as well. So you do see leukocytosis in response, again, to inflammation. If you're calling all the neutrophils to one area and they're dying, well, then you're going to need to make more because they're fighting off infection. They get to the site really quickly, but then they die quickly. Well, you want to keep and maintain the amount of neutrophils in your bloodstream. So you're just going to start producing them in your red bone marrow, and you're going to release them from there. So your body says, okay, there's an inflammatory process going on, so I need to increase demand, so I need to increase supply. So that's basically what the body is saying. There's more demand, so I need to increase supply. How do these white blood cells, like neutrophils, get from going through the capillaries or going through the blood vessels? So they're just traveling along. How do they get outside the capillaries and into the tissue? First off, the endothelial cells, so remember the inside cells of blood vessels, are going to, when they're inflamed, actually stick out kind of adhesion molecules. So it's like sticking out their hand. So they stick out a hand into the vessel lumen and grab on to those neutrophils. So the neutrophils are then from kind of the middle of the vessel. Then they're grabbed and brought to the side of the blood vessel. And that's called margination. And they cling to the vessel wall so they don't just continue passing by. So the endothelial cells stick out their hands, they grab a neutrophil, and they bring it to the side. Diabetes is actually when these white blood cells, speaking of neutrophils, are going to all of a sudden squish and flatten to squeeze between the endothelial cells. So we'll have the endothelial cells. They're not tight junctions. There is some space in between them, a little bit continuous. And so then the white blood cell or the neutrophil is going to just squeeze itself out and then go into the interstitial space, going into the tissues. So this is just a picture of what I was talking about. Again, leukocytosis is going to be an increase. In this example, it's an increase of neutrophils. It's not always the case, but oftentimes it is. If you're fighting off a bacterial infection, you're going to see an increase in neutrophils. They enter the blood from the bone marrow and then margination. Again, the endothelial cells from in the blood vessel stick out their hand or have an adhesion molecule that sticks out, grabs the passing neutrophil. And then diapetes is when the neutrophils really squeeze down and smush theirself way through, going in between the capillary cells. So just think of it as just kind of really stuffing yourself through a really tiny window or door, just kind of squishing down as much as you can and being able to go to that area. So kind of the reason why the neutrophils are doing this too, we know this is an inflamed area, so we have a lot of chemicals that are crying out for help. So inflammatory chemicals are going to call the neutrophils to this area so they can start fighting off the bacteria. So antimicrobial proteins, they can either attack microbes directly. So again, this is going to be interferons and on complement. Complement can attack microbes directly themselves. They're going to be protein molecules that are help with immune response, again, innate immunity. But they also stop microbes being able to reproduce. Again, all these microbes reproduce very quickly. So if we can maintain a population of 10 microbes, instead of letting them reproduce to 1,000, well, it's much more manageable to handle 10 microbes to stop their ability to reproduce and make 1,000 really quickly. So able to stop the reproduction helps us, gives us time for your immune system to respond. It takes a little bit for all the white blood cells to come to the area for them to fight. So hindering or stopping their ability to reproduce gives the immune system time to mobilize and respond appropriately. And this is a much more manageable number of 10 versus 1,000. So interferons are going to be dealing with viruses. So they are antiviral proteins, meaning they're against viruses. When a cell, a normal kind of cell, we have viruses are intracellular. So they go inside the cell. Viruses go inside the cell. They use the cell's DNA to reproduce and use the cell's machinery to reproduce themselves. So if you have a virus that's inside a cell, say virus is inside the cell is going to release, so the cell is going to recognize, hey, I'm infected by a virus, I'm done for. And it's going to send out interferons to neighboring normal cells. So this is a cell that's not infected. And it's going to send out the interferons. And they're going to bind to a receptor on the surface of the cell. So, and say this is an interferon. And what that is going to cause this cell to do is to produce antiviral proteins. So if this virus is going to reproduce itself inside the cell, so it's going to make more of them, and then all of a sudden they're going to be released and try to come over and infect this cell, well, they're going to be stopped. So uninfected cells are going to produce the antiviral proteins that's going to stop the virus from being able to, they can come inside, but they can't reproduce themselves. Then we can also have activation of natural killer cells. Remember, this is part of the innate or non-specific immunity. It's a lymphocyte, but it kills by poking holes in the cell. So, and allowing enzymes, granzymes to enter to cause, induce cell death. So even if these cells are going to become infected, then natural killer cells can kill them, killing the virus that's inside with them. And then you have macrophages that are going to come in and clean up the mess. Now, complement is a group of proteins. So we say complement proteins. There's a group of them. Not going to make you memorize any of them. So they travel around in the blood in inactive form. But they are kind of enhancing proteins, and they can directly destroy bacteria as well. So antimicrobial proteins, again, are going to be communication proteins you can think of. So it's going to send out the alert to everywhere. So it's going to increase inflammation. So again, we want that because you're going to increase blood flow and increase diabetes or leakiness of the capillaries, so more things can leave, plasma proteins, all sorts of things that are helpful in repair and fighting infection can leave the blood vessels. We also help the innate, calling kind of those cells to the area. And we're actually going to help adaptive defenses again. So again, these are going to be B cells and T cells, or B lymphocytes and T lymphocytes. They can also help neutrophils in the phagocytic cells by killing bacteria themselves as well. So complement, activating inflammation. Again, here's our friend histamine is released. Histamine, again, vasodilator. Increased blood flow, increased leakiness. So then by activating inflammation, again, making increased blood flow allows the blood cells to come to the area, wider road, easier to get through, but also leakiness allows them to do their diapetus and get into the tissues a little easier. Again, it's going to attract neutrophils, first line of defense of phagocytic cells, and our big players of macrophages that are going to come a little later, but they're going to be our major cells that are going to clean up the mess and kill all the microbes that are in the area. So activating inflammation helps with all the things that we talked about with inflammation of getting the cells to the area. Once you get the cells to the area, you have to bust them in so then they can fight. Complement also does something called opsonization. So they can actually, again, you have a bacteria and it's kind of reproducing and causing issues. So what happens is these proteins can then stick to the bacteria, neutralizing it. Again, it's kind of like arresting it. So it can't do any more harm. Once you neutralize it, it gives it time and it also tags it saying, hey, eat me. So we neutralize the bacteria. They can't do anything anymore. The bacteria can't. And then we can have our macrophages or our neutrophils come in and eat this. So it promotes phagocytosis in that we can come in, neutralize it, and consume it. And then we can destroy it. Cytolysis, meaning cyto means cell, lysis is kind of destruction. Complement proteins themselves can actually insert themselves into the cell membrane and called a membrane attack complex. What happens again, we've kind of learned it before, it makes a hole in the cell membrane, allowing water, most often, to go into the cell. And as we increase water, then eventually the cell is going to be destroyed. It's going to rupture. So by poking holes in cells, just poking holes in the cell membrane, we saw that with natural killer cells as well, then we can destroy the cell. So this is going to be not only but like bacteria cells, they have a plasma membrane, so we're going to cause the cells to die. So another thing is that we consider kind of a bad thing, but it's not necessarily as if it's not too high. So obviously if your temperature's 102.5 or 103, that's getting to dangerous levels. But a low grade fever is actually going to be a good thing. So what happens is a fever is a response to an infection, invading microbes. Leukocytes, white blood cells, and macrophages that are in the tissues are going to secrete chemical messengers called pyrogens. So I think pyro is someone that likes fire. So pyrogens go to the hypothalamus in the brain and actually tells the hypothalamus to turn up the thermostat. So you have your thermostat in your hypothalamus. So instead of keeping it at 98.6, the pyrogens say raise the temperature so you'll go to 100. Why is this kind of helpful? It increases the metabolic rate of your cells. And metabolic rate is mainly going to be your chemical processes, which is going to increase kind of division. So mitosis. If you have an increased level of mitosis, then you're going to have increased repair because all these cells are going to be dividing to fill in the damage and fix the damage. It also, a fever, kind of slows down or stops the reproduction of bacteria and viruses by taking iron and zinc, which is needed for reproduction of these um, microbes, and makes them stay in the liver and the spleen. So if it's needed, iron and zinc is needed for reproduction, and they're stealing your supply of iron and zinc. If you just hide it away, so if you take your cash and you hide it away, then they can't steal it anymore. So that can help. If they don't have a supply of iron and zinc, they don't have their own supply. They can't make any. They have to use yours. So if you take it away, they can't reproduce. So this is just in summary. So again, innate is first line of defense is going to be physical barriers. So the wall, remember, and the acid, so kind of the hot sand that it throws over the wall to prevent pathogens getting inside. We have second line of our innate defense of phagocytes. Again, they'll pick up the mess and eat pathogens. They'll also, natural killer cells specifically, are going to destroy any abnormal cells, like cancerous cells. So if you have a cell that mutates its DNA and it starts kind of growing and dividing abnormally, the natural killer cells can recognize that and destroy it. You have interferons. Remember, those are going to be where the neighboring cells are going to produce antiviral proteins. And if the antiviral proteins, they stop replication of the virus again. And so you can come in, kill the infected cells, and the viruses hasn't been able to reproduce. So you slow the spread of the disease, give time for the rest of your immune system to get to the area. So just linking physical barriers, secretions on your skin, your phagocytes, your neutrophils, your eosinophils, monocytes that become macrophages, and then you have the free ones that are free roaming, and you have the ones that stay in the spot. Then you have your natural killer cells that'll kill cells that are either cancerous or infected with intracellular pathogens. Mentioned in this video, complement, you will kill or have the membrane attack complex that's going to break down the cell membrane of bacteria and virus cell, or kind of bacteria and infected cells with viruses. You're going to attract phagocytes to the area, your neutrophils and your macrophages mainly. And then you're going to stimulate, increase that inflammation to allow those phagocytes to come to the area. Then fever helps kind of mobilize your defenses, increase your metabolic repair, and slows down that growth of those pathogens. So just looking at interferons, complement, killing a bacteria cell itself, just poking holes in it with its membrane attack complex and causing lysis. Increased inflammation, again, more blood flow. It can activate macrophages, increase permeability. Opposite, Complement activates inflammation. Inflammation activates complement. So helping with those killing proteins. Can help with increase of your heat, temperature, also calling your adaptive defenses, your T cells and B cells. And then we have fever.